Hello, my name is Maureen McHugh, Executive Director of the DuPage County Health Department, and I want to talk to you today about the novel H1N1 virus that is currently in our community. It's important to understand what is the novel H1N1 virus. Like all influenzas, it's respiratory in nature. It's a respiratory infection, but it's caused by a new type A influenza virus. Because it is influenza, it spreads easily person to person, and that is what's causing the global outbreak of illness among humans. Why be concerned? Well, the novel H1N1 virus is different than the annual flu we interact with. All of us are used to getting the seasonal flu vaccine, or even if we don't, many times we have a natural immunity to the annual flu. This strain of influenza is different because people do not have immunity for this virus. And like any influenza, it can be spread human to human, mostly through coughing and sneezing. Pregnant women and young adults are most at risk. In order to understand the different age categories that are most infected by the novel H1N1 virus, it's important to take a look at some of the historic data that we have. Taking a look at this chart, what it shows is the novel H1N1 confirmed and probable case rate from April 15th to July 24th, 2009. What this shows are the blue pillars is the national rate of probable and confirmed cases. The yellow shows DuPage County. What should be noted here is that with seasonal influenza, typically hospitalizations occur within ages of 65 years and older, and that's why every year you hear us talking to seniors about getting their seasonal influenza shot. The novel H1N1 is different in the age groups it's impacting. By looking at the data from April 15th to July 24th of this year, what we can see is the different age categories most impacted by the novel H1 virus. 0 to 24 years of age had the highest confirmed probable case rate, and also had the median age hospitalized at age 18. Again, very different than seasonal influenza, which most impacts 50 to 65 years and older. And when we talk about priority groups or groups most impacted by novel H1N1, this is why our concentration has been on children and pregnant women. The good news is that a vaccine is currently in development. The federal government has been very aggressive over the last 4 to 5 years to increase the capacity of pharmaceutical manufacturing within our nation, and this has paid off for the novel H1N1. Vaccine for the new virus will become available in mid-October. It'll be important to note that this flu season, everyone will need 2 different flu vaccines. First, a seasonal flu vaccine, and second, the novel H1N1 vaccine. We anticipate in its arrival in mid-October that we will see 45 million vaccines shipped, and then it will be shipped in alternative waves of 20 million every week following. We also anticipate that every individual will require 2 shots at 28-day intervals. This can't be fully determined until pharmaceutical testing is done on the new vaccine. Once it is available, the production will be high enough so that every person within the United States will be eligible to receive 2 shots. Let's talk a little bit about the seasonal flu vaccine. In DuPage County, we try to make getting it safe, easy, and quick. So this year, for the 3rd year, we are partnering with Central DuPage Hospital, Jewel Osco Pharmacy, and Dominic's Pharmacy in offering the flu shot in walk-in clinics. If you should go to Jewel and Osco or Dominic's, what you would receive is a $5 gift card that can be used at any Chicagoland Dominic's or Osco pharmacy. Getting your flu shot should be easy. All of these locations have walk-up appointments. Making sure that you and your family get the seasonal flu vaccine is your first step in staying healthy this flu season. Now let's talk a little bit about how you can protect your family and prepare for the fall in keeping our community healthy. When we talk about the novel H1N1 virus, it's important to think about it within 3 phases. The first phase we're in now, prior to the vaccine being distributed. What's our goal? To keep our community calm and healthy. As a public health agency, you'll see us continue to prepare good prevention messages on hygiene, planning for vaccine distribution, and consistently communicating with our community partners and providing surveillance on disease activity in our community. As we go into Phase 2, when the vaccine becomes available, as a public health agency, we'll be taking action to distribute the vaccine and communicating and providing surveillance to our community to ensure disease activity is well monitored. What's our goal? That by Phase 3, we've created healthy habits in not only our current generation, but future generations. Through good communication and good surveillance, we can keep our whole community healthy. What's the first step in keeping our community calm? Get the facts. Avoid rumors. Get information from credible sources. What's a credible source in DuPage County? ProtectDuPage.org. The novel H1N1 virus is something that's unknown to the community and many times can create anxiety for individuals within the community because it is unknown. It's important to understand if you see someone suffering from anxiety to try to keep them calm. A normal response to an unusual event is to have difficulty concentrating and feeling overwhelmed. This can improve with time, rest, and replenishment, but it also sometimes helps to eat properly and exercise and to stick to routines, but also to limit media exposure. Again, getting your information from a credible source is important when something is not known. Another way to be prepared, prepare ourselves for what's the inevitable. You or a person in your family may get sick. That can happen for a normal seasonal influenza, and it can also happen with novel H1N1. Isolation is one of the methods that we use to stop the spread of disease, so be prepared. Plan for possible school closings and create alternate child care plans if your child should get sick. Most important, practice good hygiene.